Hello everyone, my name is Dr. Igor, I am clinical oncologist, practicing since 2010. Today we are going to talk about diabetes mellitus of the second type and mostly about the drugs, oral hypoglycemic drugs to decrease the blood sugar to control it. Let's get started. So dear friends, diabetes of the second type is the chronic disease which is characterized by relative deficiency of insulin. By the way, often there is a very high amount of insulin, but it's not working properly, it's not effective enough. Such patients mostly are overweight. That's why we prefer the drugs, they will help them to decrease their weight. And we prefer drugs to decrease their insulin resistance, to increase their effectiveness and sensitivity to insulin. And the first step always before taking any drugs is to try their lifestyle modification. Of course, many people will say, oh, diet again, I don't want diet, I want to eat hamburgers and I want to eat cakes and just eat some super magical pill. But it's not working like that. In such a case, unfortunately, their diabetes will progress and cause the complications. And what are the complications of diabetes? Is mostly their vascular complications. It will affect vessels in all organs. For example, affecting vessels in kidneys will cause kidney failure, in extremities will cause their necrosis or death of their fingers, of their toes, feet, it can cause loss of extremities, it can affect the vessels in the brain, in the heart, in their eyes, causing loss of vision. That's why this condition is very serious and everyone must take it seriously and of course treat it as soon as possible. So first of all, because diabetes of the second type is the chronic intoxication with carbohydrates, first of all, we need to decrease carbohydrates in the diet. There are more extreme forms of diets like keto diet, for example, but it can be very effective in the diabetes treatment. That's why always ask your doctor, endocrinologist, if a keto diet may be appropriate for you or maybe some other diet, at least decreasing the amount of carbs in your meal. Also, the fasting may be beneficial, but don't forget to discuss it with your doctor. For example, you're taking some drugs, they can drop tremendously your blood sugar if you don't eat, if you miss the meal, for example. And fasting may be dangerous for you. Always discuss with your medical professional. And don't forget about physical activity because it can improve actually your insulin resistance and get the sugar from your blood to your organs, especially to the working muscles. That's why diet and physical activity. This is the basis for diabetes treatment. Often if the patients do these two things, they don't need any drugs at all. By the way, there is a situation when the patients don't eat much carbs, but still they have high sugars. There may be reasons for that, and one of the reasons may be stress, because stress releases the stress hormones that are against insulin. Their action is opposite. Insulin wants to remove sugar from blood, stash it, make deposits for the rainy day. But stress hormones, they take sugar from deposits, they produce new sugar, and they make you maximally alert and ready for fight and fright and running or doing something. It's mobilizing your energy resources. That's why it increases your sugar. So let's start from the first drug. Usually it's a first line drug. It's metformin. We see we have several groups of drugs here. Metformin, sulfonylurea, we have glitazones, and we have alpha-glucosidase inhibitors. And the last step is insulin. Insulin may be the final treatment. I mean, 30%, approximately 30% of patients that tried a lot of these, they still can't control sugar very well, and the insulin is added. So let's have a quick review of all these groups of drugs so you understand better what you're taking and what can be the problems and what you need to do. Metformin is a drug of first choice. Why? It has some pros. First of all, it reduces appetite. Very important, because many people here are obese, and if you reduce their weight, it will help with the control of the sugar. Second, it reduces insulin resistance. The other problem of diabetes of the second type, high insulin resistance. You improve the resistance, insulin becomes more efficacious, and it reduces sugar better. It reduces glucose synthesis in the organism, so it will also drop the glucose in the blood, and it reduces absorption of glucose. You see, it does not release any insulin. That means it is much more safe. It won't drop your glucose tremendously, causing coma, for example, if you miss the meal. But there are also some problems with metformin. First of all, it's a GI side effects, adverse reactions. So, some people cannot tolerate metformin, even very low doses. It can cause nausea, it can cause vomiting, metallic taste in the mouth, it can cause some abdominal pain or diarrhea, and it can cause decreased absorption of vitamin B12 and magnesium. That's why it may be necessary to check your B12 levels and sometimes to have courses of group B vitamins and of magnesium. Why? You see, neuropathy, for example, numbness in the hands, in toes. It can be neuropathy in the internal organs. For example, the food stays too long in the stomach, the digestion is impaired. You can get the constipation, you can get heartburn. It can be signs of B12 deficiency. It can be also signs of diabetes. And sometimes many patients, they get much improved situation with neuropathy if they take B12, because they can have their hidden B12 deficiency. That's why talk to your doctor about taking vitamin B12 at least maybe twice a year, and taking magnesium supplements. And one more thing about metformin is that it is excreted with kidneys, and if there is a severe renal failure, kidney failure, it may be dangerous because it can cause a potentially deadly complication called lactate acidosis. Blood becomes more acidic, and it's very dangerous because it can cause coma and death. That's why before taking metformin, everyone must check liver and kidney functions. It's AST, LT, bilirubin, creatinine, and blood urine nitrogen. So, what are other conditions that may increase the risk of these deadly complications? Except kidney failure, it's cirrhosis of liver, liver failure in alcoholics. It can be increased when there is not enough oxygen coming to the tissues. For example, it can be caused by hypoxia, when the lungs are working not normally, the saturation is low, and it can be caused by ischemia, when the blood with oxygen is not delivered enough to the tissues, for example, in heart failure. And also it shouldn't be used in serious acute conditions like myocardial infarction, like severe infections, sepsis, surgery. In these situations, we change the treatment to insulin, usually for some period of time. Okay, tired of metformin, let's go to the other drug. This group is called the sulfonylurea drugs. You can see here glibenclamide. This is the most long-acting drug. There are also some tolbutamide, gliclazide. These are more short-acting drugs. Long-acting is good, but it has more chance of dropping glucose too much. That's why in elderly people, for example, it's better to use something safer, something more short-acting. Also, there are similar drugs that works on similar receptors and have similar effects, like repaglinide and nateglinide. And this all is taken before meals. What's their mechanism of action? It's release of insulin. Release of insulin means it will stimulate appetite, it will stimulate increase of weight. Not very nice in diabetes of the second type, but in some people who don't tolerate metformin, for example, or there are some patients who say that, oh, we don't have any effect of metformin, these drugs may actually really help them. Among side effects, you may see hypoglycemia, drop in sugar. It may be facial flashing, it may be rash, fever, jaundice, usually because of the stasis of bile in the liver. It can be diarrhea, and it can cause pancytopenia, meaning that it will inhibit the bone marrow where the blood cells are synthesized. It can cause drop of thrombocytes, leukocytes, or all the cell types. But it's not often. And next type of drugs are glitazones. These are pioglitazone, rosiglitazone. They also stimulate appetite, not very good in patients with diabetes of the second type. They work through these receptors. I don't want to pronounce that because everyone will run away now, or will close the video. And they are located in adipocytes, fat cells, in liver cells, in muscle cells. These drugs actually can slowly improve the insulin resistance. Improve insulin sensitivity. And unfortunately, they can cause some weight gain because they increase appetite and because they work on the fat cells. Also, they can cause some fluid retention. That's why if the patient has, for example, heart failure, severe heart failure, when there is a lot of swelling, edema, the heart is not working well, we will increase the tension on the heart. That's why it's not a good drug. These are not a good drugs to use in severe heart failure patients. Also, it is contraindicated in pregnancy and the liver failure. And there is some connection found between the use of these drugs and osteoporosis. Next, very interesting drug, acarbose. It actually blocks the enzymes that are needed to digest the bigger carbs into smaller ones. In our gut, there are enzymes that will cut the bonds between small carbs, and then these small carbs will be absorbed. If this doesn't happen, they're not absorbed. We're talking about sucrose or starch now. That means if the person eats starch and sucrose, eats sugar, then it won't be absorbed. But if the person eats fructose or glucose, it will be easily absorbed. The problem is all these undigested carbs will go to the guts, to bacteria will ferment it, and it will produce a lot of gas and bloating and belly distension and may cause diarrhea. Not very nice side effects, of course. Dear friends, and the last I want to tell you is insulin. Insulin is the normal hormone that is needed for decreasing the level of glucose, to putting it inside the cells from the bloodstream, and it will make deposits of the nutrients in your body. This hormone prepares us for the rainy day. Some people will need insulin if all their treatment failed, and if they have very high levels of glucose, if they have some complications, maybe they have severe infection, if they have pregnancy, surgery, they may need insulin. The problem is it will increase appetite, increase weight gain. Sometimes it can be not bad if the person has the muscle atrophy during diabetes, because it will actually increase the muscle mass. But it's really difficult to control the weight if you take insulin. What about side effects? Of course, it can drop glucose in the blood dramatically if you miss the meal, for example. Also, there is some interesting situations. Sometimes people say, "Oh, doctor, I wake up in the morning and my level of sugar in the blood is very high. And should I increase the dose of insulin?" The problem is it's not because of not enough insulin. It's because of too much insulin. It can happen. One of the mechanisms. Because the person ate, for example, a meal at 7 in the evening, then he took the dose of insulin, and he sleeps. The carbs are digested, the carbs are absorbed, the levels of glucose are high, insulin is working, then the levels of glucose will finally drop. And there is still too much insulin. And the person, in the morning, he's still sleeping, it's very early morning, has a very low levels of sugar. What will our body do? It will release stress hormones and tell body, you must produce more sugar, you must take out deposits and bring the sugar into the blood. And of course, these stress hormones will be released in big concentrations, and when the person wakes up finally, the levels of glucose are very high. That's why high blood sugar in the morning may mean that the insulin dosages are too high. Dear friends, we are all different. we all have our own diet, lifestyle, genetics. Doctors can't always choose their ideal perfect treatment from the first time. Sometimes they need correction. Best of all, you have the diary where you will write down when you eat something, where you take the drug, where you have the insulin shot, and measurements of your glucose. Then you come to your endocrinologist and he will see and he can correct your treatment. And this is all for today. I wish you good health. God bless you. Bye bye.